Thank you very much, Mr. Dominic Elian, for the elaborate introduction. And thank you all for giving me the opportunity to present to you overview of retinoblastoma research in African countries, prevalence and access to services. So this is where I work, the Tamale Teaching Hospital, which is the only tertiary hospital and referral center in northern Ghana. I have no conflict of interest to declare. I would like to first of all thank the University of Alberta Global Health staff, especially Patricia Grill, for her time and support during my PhD work. Also, University of Alberta College of Health Sciences and the Dean and Vice, Dr. Brenda, for this opportunity to present this work. Also, I want to thank the Faculty of Medicine and Dentistry for their support in my PhD work. And special thanks to Drs. Carlos Solati and Analdo Perez for their support. I will look at the overview of retinoblastoma research in African countries, the prevalence of retinoblastoma, access to services, conclusions, recommendations, and research gaps and future directions. So retinoblastoma is most common intraocular tumor in children, and it is usually due to malignant transformation of retinal cells. And this occurs sometimes in utero or immediately after birth. The worldwide prevalence is 15 to 20,000 per birth, and it is curable condition with survival rates of more than 90% in developed countries. However, the survival rates are abysmal in developing countries, with just about 20 to 30% surviving. So this early presentation in our situation where the patient has come with a white reflex or the glow in the left eye in a 2-year-old child. In the developed countries, this patient would have been seen earlier, probably at 3 months or at most 6 months or even 1 year. But in Ghana and most developing countries, they will come very late. The child is coming at 2 years, where the disease has already progressed. Delay in use of health services is a big challenge, and that now leads to late diagnosis and appropriate treatment. A lot of children come with extraocular disease in most African countries. So this child with retinoblastoma in the left eye, and as you can see, this child is coming at the age of 4 years, with a very late presentation, proptosis of the left eye. And most of the time, there will also be cerebral or brain involvement, or other parts of the body may be involved. And in that case, palliative care may have to come in. So some of the main issues are lack or limited access to healthcare services. Sometimes patients have to travel long distances to reach treatment centers, and this can discourage them from coming early. And lack of awareness. Some parents or caregivers are not aware of childhood cancers. So though they may see there's something wrong with the eye, but they don't know what it is, and may not come to the hospital. They may only come when the signs are already too late. Sometimes the cost of treatment may be an issue for them. And there is high disparity in survival rates globally, and this is even more severe in developing countries. And all of these will now lead to poor prognosis. So this is a typical road in most developing countries, and this picture was taken of a vehicle that was plying on a very poor road and sustained an accident. So if a child is supposed to travel from a very far community to the treatment center, they will have to ply on a road like this. And you can imagine how difficult it will be for such children to come to the hospital. The incidence rate, as reported in most sub-Saharan Africa, is 1 in 15,000 births. And the prevalence in most developing countries is more than 1.5 cases per million children under 5. And A study in Nigeria reported that incidence of about 2.5 cases, but these may be underreported, as shown by many other studies. The incidence and outcomes can differ dramatically across the continent, with urban centers having better detection rates compared to rural centers. Comparative studies that are done in Africa have shown that a lot of retinoblastoma cases are underreported, and most of them come in late stages beyond treatment. A study in Uganda highlighted that diagnosis delays contribute to relatively high mortality rates. The study emphasized the urgent need for more effective treatment and nationwide efforts to encourage earlier access to medical care. In Ivory Coast, that's Cote d'Ivoire and the Democratic Republic of the Congo, studies that were done there revealed that access to diagnosis care is a big problem, and that now leads to late diagnosis and treatment. Awareness campaign in South Africa has led to increase in diagnosis of retinoblastoma, but it has not impacted late presentation of retinoblastoma. So though community members are aware, may be aware of the signs and symptoms, but if one way or the other, they don't tend to come early, and they may come very late. And this has also been shown in Ghana in some of our communities, where the increase in awareness is there, but then patients still come late, at late stages, probably due to other reasons such as economic reasons and then bad roads. So access to retinoblastoma services in Africa can be, issues with access can be described in these 5 terms: limited resources, early detection and diagnosis, treatment modalities, socioeconomic factors, and then so we realize that health services needs assessment have shown that human and material resources needed for retinoblastoma care are constrained in many African countries. Poor infrastructure, restrict access to healthcare services, especially in rural regions, as most of these specialized centers are in the urban centers. But most of the patients who suffer from retinoblastoma tend to come from the rural centers. Many African countries face significant healthcare infrastructure challenges, which impact the timely diagnosis and treatment of retinoblastoma. So there's a typical healthcare infrastructure or facility in most African countries where the infrastructure is limited in many ways in diagnostic equipment and tools. They are not usually available in most peripheral hospitals. In many African countries, only a limited number of specialized facilities cater to pediatric oncology, leading to delays in treatment. Many countries lack comprehensive cancer registries. There are no accurate data collection tools, and therefore diagnosis and treatment quality is compromised. Tier 3 retinoblastoma facilities are rare and mainly concentrated in the urban centers, making access difficult for many patients who hail from the rural areas. And travel burden is a big problem. Distances to treatment centers are very wide. So late presentation, often due to lack of knowledge about the disease, contributes significantly to poor outcomes. And many families seek treatment only after visual symptoms become pronounced, in which case it may be too late. And most patients present at advanced stages due to limited awareness among caregivers and healthcare providers as well. Diagnostic delay significantly contributes to higher mortality rates, unlike in developed countries. Educational campaigns targeting health professionals and communities can enhance early detection and referral practices. Educational initiatives to increase awareness of retinoblastoma symptoms can significantly aid in the prompt referral and treatment of retinoblastoma patients. So this, if we are able to organize more health educational awareness programs in the communities, in the rural areas, and in health centers among primary health providers, then that can help in letting people detect the early signs early enough and then refer such patients to treatment centers. Access to effective treatment options, including chemotherapy, radiotherapy, and surgical care, is often limited in many African countries. Many families may face financial barriers that prevent them from coming for timely intervention, as they are unable to afford treatment in some instances, even if diagnosis is made. Countries like South Africa have developed more structural programs, yet many others still grapple with treatment accessibility, as in Ghana. This is a patient who has had enucleation. Enucleation is removal of the eye. In this case, the right eye was removed in this patient because the patient came late with proptosis. So surgical treatment had to be done. In some instances, some families cannot afford this treatment. Socioeconomic status profoundly influence access to care, often resulting in unequal treatment outcomes. Families with lower economic status frequently delay treatment, leading to higher mortality rates. Unaffordable treatment costs is a big problem in most African countries. In Ivory Coast and DRC, the median cost for treatment was estimated at over $1,000 per patient, and this is beyond the reach of most families. Children in East Africa present at an average of 9 to 11 months later than their counterparts in the US and Canada, leading to poor survival rates. Now, we think that to solve these problems, we need to do more in terms of increase awareness, educate communities and healthcare providers about early signs and symptoms of retinoblastoma, and also to have to work on early detection to improve on survival rates, also to improve access. Enhancing access to diagnostic and treatment facilities is key to improve survival rates in these patients. And then financial support groups and financial aid can help families afford treatment. So this is a breakdown equipment. This is a CT scan that has been broken down in the Tamale Teaching Hospital. There are also MRI machines that have been broken down. And these are very essential for diagnosing or for the management of retinoblastoma. But once they are broken down, sometimes it's difficult to get them repaired. And that deprives children of access to treatment, and therefore have to refer them further to Kumasi or Accra, which even further compounds their financial crisis. So we need to embark on capacity building, that is to educate and empower healthcare providers to detect early signs of retinoblastoma. We have to focus capacity building efforts and increase efficiency in retinoblastoma therapy. These efforts are essential to improve the survival rates of children with retinoblastoma. The landscape of retinoblastoma in African countries reveals significant challenges related to prevalence, early detection, and access to treatment. Improved healthcare infrastructure and educational programs will minimize late presentations. Enhanced collaboration between healthcare providers, policymakers, and communities is essential for improving outcomes of children with retinoblastoma. We recommend that we need to address these challenges in developing nations, and this involves not only technological advancement, but also social and economic considerations. Steps including disease education, that is education on early signs of retinoblastoma, counseling, universal screening, subsidized treatment, and training of healthcare personnel are very important. So the research gaps and future directions in terms of retinoblastoma is data collection and registries is a big challenge. There is a pressing need for comprehensive cancer registries in African countries to accurately capture the incidence and outcomes of retinoblastoma. Genomic studies are non-existent in most African countries. In Ghana, we don't do any genetic studies on all our retinoblastoma patients. So research exploring genetic and biological factors related to retinoblastoma in African populations is still very limited. Investigating these aspects could provide insights into risk factors unique to these populations. Though there's a lot of genetic studies that have been done on retinoblastoma in developed countries like Canada, In African countries, no genetic studies have been done on patients with retinoblastoma, and probably the factors that has been identified in Canada and in countries may be different from what pertains in, let's say, Ghana or Africa. Awareness programs need to be strengthened. Public awareness campaigns, training for healthcare professionals is very critical for the early identification and management of retinoblastoma in our countries. So the picture to my left is a child with advanced retinoblastoma proptosis in the left eye, and the picture to my right is one who had proptosis as in the left eye. We had given chemotherapy. After that, we enucleated the eye and we have put in prosthetic eye. Sometimes the prostheses are not even available, and orbital implants sometimes are not available. And even when they're available, the costs are beyond most of what the patients or their parents can afford. These are my references. Thank you very much for your attention.